Welcome to GE Healthcare's Introduction to Weaning from Mechanical Ventilation in the ICU. I'm Lisa Nolan. Each year, thousands of patients are mechanically ventilated worldwide. As a patient's condition improves, clinicians will evaluate the need to discontinue the ventilator. Did you know that 41% of mechanical ventilation time is spent on weaning? There are various methods that can be used to evaluate ventilator discontinuation, such as a T-piece or CPAP trial. Some ventilators, like the CareScape R860, offers a programmable mode to allow the clinician to assess a patient's ability to breathe spontaneously. Clinicians who use a standard weaning protocol are able to reduce weaning time by 78%. Today, we will discuss the CareScape R860's spontaneous breathing trial. Let's get started. When a decision is made to begin weaning a patient from a ventilator, an SBT or spontaneous breathing trial may be performed. SBT mode allows clinicians to evaluate a patient's ability to breathe spontaneously during a specified duration of time. Trending information gives the clinician the ability to review past spontaneous trial data. Prior to SBT evaluation, the clinician should enter the following: SBT duration, apnea time, high and low expired minute ventilation alarms, and high and low respiratory rate alarms. The ventilator will use these alarm settings as pass-fail criteria to determine if ventilation should resume at the previous mode of ventilation. Once the alarm stop criteria is entered and Start SBT is selected, the SBT general message shows along with the procedure countdown timer and progress bar in the lower left above the current mode selection. During the SBT mode, the patient initiates spontaneous breaths as the ventilator maintains a set PEEP level and provides pressure support when added. The spontaneous breathing trial will last for the set time unless any of the stop criteria are met. If the stop criteria is reached, an alarm will occur and the ventilator will change back to the previous mode. The clinician will need to decide if they would like to resume the SBT or confirm the current mode of ventilation and end the spontaneous breathing trial. If the set time is reached, the spontaneous breathing trial is complete and the ventilator will resume the previous ventilation mode. At any time during the spontaneous breathing trial, the clinician can access the SBT view under the Clinical Decision Support Tools to review both graphical and numerical data and trends related to the current trial. Data from a previous spontaneous breathing trial can be reviewed if it was completed within the last 12 hours. Reviewing past data allows the clinician to see the patient's respiratory rate, expired minute ventilation, expired tidal volume, rapid shallow breathing index, and end tidal CO2, which can help to assess the success or failure of the previous trials. Here's a scenario. For the past several days, John has been intubated on the CareScape R860 with ARDS. His arterial blood gases and X-rays indicate that John's condition is improving. John has been on full ventilatory support using bilevel pressure ventilation since his admission to the ICU. His tidal volumes have been around 500 milliliters, and his rate is 15 breaths per minute, which is showing John is breathing above his set rate of 10 breaths per minute. Dr. Jones and John's day shift respiratory care practitioner, Sally, have decided to assess John's ability to breathe spontaneously and have decided to use the spontaneous breathing trial on the CareScape R860. Dr. Jones writes the order for SBT for 1 hour, twice a day, with the settings of 5 centimeters of water of PEEP and 10 centimeters of water of pressure support with 40% oxygen. As Sally enters Dr. Jones' settings, she also considers the stop criteria needed since this is John's first trial. Sally enters the apnea time of 30 seconds, a high respiratory rate of 30, and a low respiratory rate of 4. High expired minute volume of 7 liters per minute, and a low expired minute volume of 3 liters per minute. She then selects Start SBT and the trial begins. Sally waits for a few minutes as John begins breathing comfortably, then leaves the room. 30 minutes later, Sally returns to the room to find that the spontaneous breathing trial had ended and John was back on his previous ventilation settings. Sally selects the current mode on the ventilator and confirms the settings to end the spontaneous breathing trial to allow John to rest. Sally reviews the SBT view under the Clinical Decision Support tool and finds that John's respiratory rate jumped to 35 breaths per minute and his tidal volume significantly decreased to 150 milliliters, showing an RSBI of 233. Sally calls Dr. Jones to let him know the results of the breathing trial. Using a spontaneous breathing trial as a precursor to wean a patient off the ventilator is as easy as that on the CareScape R860. I'm Lisa Nolan with GE Healthcare. Thank you for joining our discussion on weaning from mechanical ventilation in the ICU.